Ready? Okay, ready?
Clean.
Amputation. You gotta get him ruled.
If you're injured and can still move, come to the sound of my voice. Over this ledge, still move.
The U.S. Tactical Combat Medical Care Course has been training medical soldiers since April 2004. The course was started by several physician's assistants who noticed that many soldiers were being sent downrange to combat zones, realizing they were not fully equipped to handle serious combat-related injuries.
Initially, it was PAs only. Ultimately, we ended up training, and we still currently train doctors, nurses, and senior medics going to Role 1, Role 2. So our aim in the curriculum is to prepare anybody going to a Role 1, Role 2 to be able to work at point of injury. So most doctors and even some PAs that's not their wheelhouse. That's not where they work. They don't know what's in the set skits and outfits. They've never worked on their knees in the dirt out of an aid bag. So it's to get them ready to do that. And as an aside, or additionally, it helps the people that come through here. We have a secondary aim at trying to get them to understand how difficult it is to do this work, particularly outside the FOB. We prioritize the training to Army green suiters that are under 180 days got a deployment order in hand.
The course runs Monday through Friday for applicants deploying, although they receive applications for those not deploying but still need the sustainment training.
The way the course is laid out, it's about a third didactic, and then the rest of it is hands-on. So they're using, equipment that they will be using downrange, but frequently they're not really versing on it. They've never seen a lot of the things that they use here, so it's good, just-in-time training.
124.
This course forces them to improvise, to think on their feet, to take a lead in a trauma team type operation, which is not normally what they do.
What's on the sides here? Yeah, big vessels, man.
It's focused mostly on point of injury care, and then also we do trauma resuscitations in the aid station.
You teach that class tomorrow morning, I believe. Rapid sequence induction. I would expect you to be expert.
We take, right now we're currently at about 24 students a class. The class can vary in size because of the number of instructors. We have a kind of a strict ratio requirement of 4-to-1 on instructors to students. Originally, the course was what's called just-in-time training, just pre-deployment. We'd get soldiers 120 to 180 days prior to deployment. But over the years, we've seen that it needs to be sustained. So what we look for in an instructor, we want a nationally certified PA. We take the green suit, active duty guys, when we can get them, but there's kind of a shortage of them in the branch right now. On the civilian side, we're looking for those retired civilian PAs, and we want them to have an Army background. We want them to have 2 or more deployments to the current theater.
Although students are all medically inclined, they still sometimes have difficulty altering their ways of practices from the hospital to the field.
Usually it's transitioning from what they're used to doing a lot of things themselves. Frequently providers, if you're in a hospital or a clinical environment, they can say, you need to start an IV, give him 20 milligrams of this and 2 liters of fluid, and I'll be back in a little while. Well, there are no fairies to come around and take care of all that stuff for you, and so providers have to learn to do a lot of those things themselves. We start working with them on the first day. Our course is very busy. We don't have any wasted time in here. We only have 5 days. And we do more than half of the course is hands-on skills. Getting people up, making them do stuff, making them practice things. And you see a marked improvement from Monday to Friday's culminating exercise. They are significantly better. They are certainly more confident and more capable. We've always found the need to be ready for a conflict. And whether it's a low-level conflict, austere environment like Syria or Africa, we also still need to be ready for a high-intensity conflict with a peer or near peer adversary. So these skills frequently go away after conflicts, and we've seen that repeatedly. We learn a lot of stuff over a short conflict, and then it's quiet for a while, and those guys with the experience get out and go away, and those skills go away, and that institutional knowledge goes away. So we need to work harder to keep it.